And up next, we welcome Alexander Dahl and Baptiste Lager of Akinox Excellent. The microphone is yours. Welcome to our virtual podium.
Thanks, Mark. It was fantastic to see Kelly's presentation and hear about the work done at UHN. COVID has really highlighted so many aspects of the healthcare system that have been bursting at the seams, let's say, for a long time, but were really exacerbated during the pandemic. So we're going to talk to you about one of the implementations to help solve some of those issues and bring another tool to the toolbox of public health. Our presentation is titled Building the Apps That Beat TikTok, Facebook, and Instagram. It's a bit of a clickbait, but we'll get back to that. So we're a Canadian company nearing 100 colleagues working from within Canada and internationally, and seeking to help bring a technology platform that supports digital process automation within healthcare to help reduce the impact of efficiency and effectiveness of lacking resources and putting the patient at the center of care. Our platform was used for pandemic response, for virtual care, for screening, early childhood disability diagnosis, and many clinical pathways across 65 specialties and subspecialties. But we're going to focus on the applications that we've built in the context of the pandemic response. We built a full ecosystem for certifying COVID-19 vaccination in Canada, and this is from issuance to holding and verification. We started way back when in March 2021, emitting proofs of vaccination certificates for the government of Québec. And this was the first North American jurisdiction to adopt a digital proof of vaccination credential. This was before the Smart Health Card was an officially adopted standard. In summer of 2021, then working with the other provinces, Canada recommended the adoption of the same standard that was demonstrated in Quebec to issue a proof of vaccination certificate using the Smart Health Card standard, which is based on open and interoperable notions, and that is seeks to be as privacy safeguarding as possible. There were other solutions looking for a problem, let's say, solutions with blockchain, hyperledgers, private links that individual provinces would issue, but that would not solve the piece of equity of access to give the information to the patient or to the population, that they would be able to have those credentials verified in other jurisdictions or internationally, which was the objective to do so, and to do so in a context where everything was an emergency, as you've known. In September 2021, the first mandated uses of the verifier applications were released for Quebec, and followed by Saskatchewan and Newfoundland in the fall, that have adopted the same sets of technology that we have provided. A little known fact is that as of October, our applications were the first ones to recognize foreign proofs of vaccination too. Unfortunately, there's not a single standard for verifiable credentials internationally, but our applications made the experience seamless for travelers to the Canadian provinces to be able to recognize EU DCC's standards within the same applications. So to date, we've issued more than 12 million proofs of vaccination certificates, and it's still required for travel. So I was a bit tongue-in-cheek with the title, but we did beat Facebook, TikTok, Instagram, and whatever the young ones use these days in September 2021 with the release of the app. Now you may say, yes, it's a mandated app, but in fact, the verification was mandated. That the wallet apps that holds the proofs, people could have produced a paper credentials, kept a PDF or a scan of their QR code on their phone, and they chose to use the wallet application. So ease of use and a practicality for people that had to present their proofs of for domestic use case and then for travel use cases. was a critical part of this design. So it resulted in 12 apps managed on different platforms, and it turned out for the year to be the second most downloaded app on the Canadian app stores. Now, it's a little unusual for IT providers to be so exposed to media attention. As you can expect, this was not an easy subject to deal with at many levels. Their policy had to be involved, explanation of how the privacy is safeguarded, how you're not tracked when you're using these tools. So going from lines of code to lines in the media, it's in a matter of hours. It's an unusual experience for IT providers, and this led us to really have highlighted some lessons that were applicable to this context of doing high volume, high velocity, public use of technology for bringing the information directly to the end users, to the patients. So the brains behind the technology, Baptiste, on the call with us, is going to share some of those key lessons that we think are applicable to anyone rolling out technology to patients or to the public.
I think we're lucky enough to see that this success changed completely our perception of how we build products and apps and how we roll them out. And we learned a lot. And the first thing we learned is that when we claim we're building something that's designed to be private, when we use privacy by design, we cannot just stick to the buzzword. We decided very early on that the application should be offline first, that you can use your app whether you have internet or not. We knew we needed to work without analytics, which is really hard to go back to your stakeholders and just tell them, we don't know what's happening with our apps, but yet we had to do this every Monday morning. This led to educating the stakeholders, but also embracing public scrutiny. You saw a few articles, and we took some hits. We had some wins, but it was definitely interesting to see this moving. A bugless experience doesn't exist. We will encounter bugs whenever we publish software. Users will live through bugs. The only issue is when you have more than 10 million users, 1% of bugs is a lot of support calls to support hotlines. We need to iterate carefully while remembering that we're in a pandemic, and we also need to iterate fast. We need to educate users around the concept of updates and how can we force updates to a system that's not supposed to be offline. We need to facilitate rollback. More than once, we started rolling something out in the nature and then realized it was incompatible with a lot of phones out there. And the offline apps are hard to fix. For a website, you can just push an update. For an app, you need to push it to all the devices individually. When users have to use the service, user experience is key. Nobody's going to read the manual. Nobody's going to read the help center. Nobody's going to look at anything. They want to use it right off the bat. So we need to change the way we design health software. We need to drop acronyms or technical terms that user will not understand. We have to work with accessibility. It might seem hard to do when, for visually impaired users, to scan a QR code is a challenge, but we had to think and devise something around this. And we need to make sure that however the user think they can get to the result, they will get to the result. So design a few ways around a problem to get to the same result. And during a crisis, we still have to care. We cannot leave anybody on the side of the road, especially if it's mandated. Every issue matters, and I think I can't count the number of late night calls that we've had to solve the problem, or of one or two citizens in the province. Iterating fast is not an excuse to exclude certain users, and we need to care during the whole process. And those are a few of the lessons that we learned on the way.
Thanks so much. Our time is limited. We could expand for probably write a book at this stage on a lot of these, and integrating everybody. That also means a proper offline first experience, paper-based solutions for people who are not at ease with technology who don't have smartphones even. Accessibility was a key consideration, and the design occurred with people who have disabilities to ensure that it was that most contexts could be adequately supported by the applications. So what's next? This I think highlighted really the appetite for patients to be sovereign in their care, in access to their own information. I would say sunlight is the best detergent. Being able to give everybody their verified credentials highlighted mistakes that were done in binding the identity, in the wrong date or the wrong dosage. So being able to have immediate access to one's own clinical information, I think, is going to be the next step, and doing it in a way that supports a holistic continuity of care across the silos that we find in healthcare, not only within a province or jurisdiction, but also internationally. So interoperability, we have to go beyond standards. We have to really look at the user experience, the context, the consent, the flow of data, and how do we allow individuals to really maintain their ownership of their own data and decide who they get to share it with. So associating their digital identity, the know your customer aspect of all of this, how do you get the levels of assurance that you can say, I can share this data, this information about my parents because they're elderly and I care for them, but to what degree and with whom? And to really support an experience that goes internationally. So give control of their data across borders, all levels of borders, again, whether they're institutional or of language or internationally, to really be patient-centered at the end of the day. These apps for some of the provinces were the first mobile apps ever published by the healthcare ministry. So and this was 2021, there's a lot of catching up to do, I think, and in bringing technology to bear to help put a patient experience at the center of care. Maybe I'll end noting that the Vaccine Credentials Initiative, with whom we've collaborated, founded in the Mitre Corporation and involving lots of public and private sector partners to hone in around the principles of sharing verifiable credentials for data, was renamed from Vaccine Credentials Initiative to now Verifiable Clinical Information. So we're experimenting with how those standards have come to play in an emergency context in COVID, to be able to give people vaccine credentials for all of their types of vaccines and help certify them for schools without sharing unnecessary clinical information. Likewise, the International Patient Summary, how we could have smart health links that would allow you to have verified, certified information that you can share across the borders. And we invite everyone on this call who's interested in this subject to reach out to us and to look for collaborations to help make this happen. So thank you, and I hope you're all enjoying your conference.
Well, thank you, Alex Baptiste, for that interesting look at building apps amidst a pandemic. And you both touched on this topic, which I think is critically important. We've seen over the last 18 months or 2 years is the pace of transformation has picked up, I mean, obviously across the board. And you both talked about, enabling that through clear and tight communications between the technology leadership and the business leadership, both internally as well as in sort of multiple client contexts. If there was one or two key rules, I know you've shared some key messages with us, but just in terms of, enhancing the pace of change with tight communication and clear communication between technology leadership and business leadership, what would you leave our attendees with in terms of advice? We'll start with you, Alex and Baptiste, and then I'll go to you, Kelly.
That's a great question. Definitely a lot of red tape has been eliminated due to the context, the emergency context. That was a breath of fresh air. And I think we can leverage the methodologies, the agile methodologies, working in true partnership, having innovation procurement rather than laborious long waterfall designs of what an institution or a government may think they need that 3 years later ends up in a solution that doesn't fit well. So having that intimate collaboration, that capacity to bring everyone in the ecosystem, patient partners, clinicians, IT providers, to innovate. I think governments should really focus on the infrastructure, setting the size of the tubes for the sewers and ensuring that consent and data sharing are all well taken into account, that the rules of the game are clear to everyone, that there's open interoperability, but that the collaboration should really be fostered at all levels so that we go towards innovation in a collaborative manner.
Thank you, Baptiste. Thank you, Alex, for bringing your insights and thought leadership here to us at eHealth 2022.